Hello and good morning, dear viewers. You're most welcome to the DAKTARI show, and this is a health edition show which airs here every Thursday on National TV from 10 a.m. to 11 a.m. where we bring you people who come educate you matters regarding your health. It be nutrition, it be dental cases, it be surgical cases, and we have always had exciting episodes for your viewers. And today we yet have another exciting topic, which we call intestinal obstruction, which our medical professionals call IO. So we have some guest, Mr. Wycliffe is going to introduce himself. Then he will take us through what is an intestinal obstruction, which things could you be doing in the community which could put you at a risk of getting these intestinal obstructions. You're most welcome to the DAKTARI Health Edition show on National TV. Mr. Wycliffe, you can introduce yourself to the viewers.
Good morning, dear viewers. Welcome you all to West Nile TV. This is a very good morning. I think God is the one who has made us reach this day. Yeah. My name, as the moderator said, I'm Twinamas Wycliffe, and I'm still a student at the Muni University. Although we are now in our final year and we are almost now leaving, and it is a pleasure that I'm really finishing this course.
Okay.
Yeah, thank you so much.
All right, thank you too, Mr. Wycliffe. Let's speak on. We are seeing intestinal obstruction. Actually, most people in the communities, maybe let me just give a small clue to the viewer who may not know what an intestinal obstruction is.
Yes.
Like this is like failure to pass stool. In the community, you fail, you can't visit the toilet for several days. That's what we call an intestinal obstruction. There is always an obstruction in your stomach. But now, because most people may always get this thing, they don't know what it is. Before even we go into this intestinal obstruction, which system mainly is affected in this, let me say, health concern of intestinal obstruction, and what things could be done to improve it? Yeah.
Thank you, Mr. Moderator. To talk about the system that is being affected, so first of all, we have to first know the anatomy or the structure of that parts of the body that are being affected. And so here we are having the GIT, or what we call the gastrointestinal tract. And the gastrointestinal tract, it starts from the mouth. So when you eat your food, you know, you first put it in the mouth. So that's where you put your food. That first part you put the food is also the first part of the gastrointestinal tract. So then from the mouth, now we go to the what? The esophagus. So that esophagus, it is a muscular tube. So that muscular tube, it is between the mouth and also the what? The stomach. So that muscular tube is the one which moves your food from the mouth now to the stomach. So you know, like when you are swallowing, so that food, when it is passing through, the way you feel it is passing through, so that tube through which it passes, we call it the what? The esophagus. So after the esophagus, now there comes the what? The stomach. So the stomach, for it, it is like a bag. In fact, when you eat food, the food is first stored in the what? In that stomach, for about 4 to 6 hours. Then after that, it starts now descending down or going down. So from the stomach, we now go to the what? To the duodenum. Then from the duodenum to the small intestines, then to the large intestines. Now, it is important to know that the duodenum is part of also the small intestines. Now, why are we calling them the small intestines? So those intestines, they are a bit smaller compared to the other ones, which we call the large what? Intestines. And it is the longest part of the what? Gastrointestinal tract. Then from there, we go to the what? To that large intestine. And that large intestine, for it contains, also it is divided into some parts. So here we have what we call the cecum, is the first part. That is where we find the appendix. And in fact, sometimes when that appendix is inflamed, we call that one what? Appendicitis. So food first passes through the cecum, then from the cecum it descends now up and now again down. So where it descends now, that is the what? The colon, or the large intestine, the second part of the large what? Intestine. So at the long run, we shall reach now the what? The rectum. So rectum, after the absorption of the food, now that food, which the waste products which we do not want, now they are stored in the what? In the rectum. So that rectum, it has like a closing mechanism and an opening mechanism. So that closing mechanism and opening mechanism is the one now what we call the anus, which is the last part now
of the system.
So that anus is the last part. So if it opens, it means for you, by the time it wants to open, it will stimulate you to go and what? To go for a long call. So when it is closed, it starts bulging, collecting those waste products. Yeah, so that is the system that we are going to talk about today. Now, so when any part of it is blocked, that is when we say you have a what? Intestinal obstruction. Because we have blocked somewhere along that path that I have explained.
So let me say, like food particles, if they're in the stomach, they can't now come maybe to the duodenum. Like there is a blockage, or if food is in the small intestines, it can't flow from the small intestines to the large intestines.
Yes. Okay. So that one we call it intestinal obstruction. So that GIT, or the gastrointestinal system, it has very many uses. For example, you see, when you take in food, it has to be absorbed. You see, because it has to join the blood system so that it is distributed to your whole body and you get energy to go and work. So that GIT, especially the small intestines, they are the ones which are responsible for absorption of the what? Of that food. Then second of all, it is important in digestion, breaking down those food particles. You see, when you have the food on the plate, it's always in big quantities. But when you put them in the mouth, first of all, you have to first what? Chew. So in the process of chewing, it means you are breaking down into what? Small particles. So that one doesn't stop there. We also have enzymes which are also inside there. So they are also important in the digestion or breakdown of those food particles. So when now those food particles, they go down into the stomach, they also, the digestion continues until it will be absorbed into the what? Into the whole system. Yes. So again, it is also important in the absorption of water. You see, like the large intestines, for them they specialize in that one. For the food itself, it is for the what? The small intestines. But for the water, it cannot be absorbed in the what? The small intestines. However, for it will be absorbed now in the large what? Intestines. So you see, absorption of water is also very important, because if you don't have water, it means you will be what? Dehydrated. Yeah. So it also produces some hormones like motilin, and that one helps it in the contraction and relaxation of that what? Gastrointestinal what? Tract. And that one is important in the movement of that food so that it can what? It can go easily and it becomes what? Absorbed. Yeah. Then we also have blood production. Yeah. For example, we have the intrinsic factor of calcium. That one is produced, it is in the stomach. So that intrinsic factor is important in the absorption of vitamin B12. So that vitamin B12, yes, that vitamin B12, so that vitamin B12 is very important in the production of what? Of blood. So because it is important in the formation of iron, now which is also important in the formation of what? Of blood. So you can see how very important it is. It also contains bacteria, and those bacteria, especially in the large intestines, those bacteria, they are very important in the digestion of food. If those bacteria are not there, your digestion of food will not take place very well, which means we need that bacteria so that we can what? Digest our food, much of our food. Yeah. So those are some of the uses of the GIT. So you can see that your GIT is very, very what? Important.
Okay, thank you very much, Mr. Wycliffe. Indeed, you have shown us how important this gastrointestinal tract or the GIT system is useful. And you have told us in case there is any blockage, that's when we shall get this intestinal obstruction.
Yes, yes.
Maybe now, a viewer may be like eager to hear from you now, what is an intestinal obstruction from that informed point of view?
So then now, what is intestinal obstruction? We have seen all those uses. So now, intestinal obstruction, that is if we are having any blockage or any delay in the flow of that food through the what? Through our GI tract. So that delay in the GI tract, it means the food will not go what? Very well. And if the food cannot go very well, it means it starts cramping back. And if it starts cramping back, it starts accumulating in that part of the what? Of the body. That is what we call intestinal obstruction. Thank you so much.
All right, thank you to Mr. Wycliffe. I indeed hope our viewers have gotten to know what an intestinal obstruction is in case there is a blockage mainly in your system. So how can someone know he or she has an intestinal obstruction? How do these people always present those symptoms? Yes.
Yeah, so thank you so much, Mr. Moderator, for that question. Now, how they present, or some of the signs and symptoms that a viewer can know that is maybe having intestinal obstruction. One, we have bloating, like there is a lot of gas accumulation in the what? In the stomach. So if you have a lot of gas accumulation, it means that gas is not passing through the intestines and being released outside of what? Of the body. So it means now, since there is that blockage, it starts what? Accumulating in what? In the body. And that gas accumulation, it comes as a result of that food which has remained in those intestines. Meaning, now the bacteria which I've talked about, which is supposed to be normal, now it starts now having action on those what? On those food particles. So in the long run, they produce gas. So that gas starts accumulating in the what? In the small in the intestines, causing bloating. Or you see your stomach is what? Is distending. So another one, we have constipation. So constipation is the inability to pass stool for some time. So you find instead of eating like 2 or 3 days, 3 times in a day, you find you take the whole day without what? Without going to the what? For a long call. You take 2 days. You have not gone for what? A long call. So that one we call it what? Constipation. And that constipation, if it happens, it means now that food is not being expelled. It is accumulating in the what? In that system. So being one of the what? Of the sign and symptom. Then another one, because of that abdominal distension, it means you have to feel the pain. So there will be abdominal what? Abdominal pain. So that abdominal pain, of course, it comes as a result of what? That abdominal distension. And it sometimes, by the way, it is very severe. You find it is very what? And sometimes it comes in episodes. At this time, you may have it. Then at some time, it gets relieved. Then after some time, you also get it. So that pain. Then, of course, we have other symptoms such as like general body weakness. Of course, since you are not, that food is not being absorbed into the system. So you will have now general body weakness. You will not have energy because that food is not being absorbed to be what? To be used. So another one, you will have increased heartbeat. Because of that distension, it will also press on the heart, which means also your heartbeat has to what? To increase. Even the respiratory rate, it has to increase. So yeah, even anxiety, it has to come. Yeah, because you will be restless. That it creates a lot of discomfort inside your what? Inside your abdomen. It means you cannot feel at what? At rest. That discomfort is the one which brings about all those. Then sometimes you may have fever. So fever may also come in because that bacteria, when it starts accumulating, it may now look for a way of how it can spread, now causing that fever.
Yeah, so like this bacteria brings about like an infection. Okay. Yes. So maybe also what I would like to know, and also maybe the view outside there, do these people also have dehydration?
Yes. Because we are not absorbing that water into the system, it means now it starts accumulating in what? In that system, in the gastrointestinal system. It is not being absorbed. It means the body will now start being depleted of what? Of the water, now leading to what? To dehydration.
So now here someone may present with like dry lips, syndrome.
Yes, dry lips, lethargy, like general body weakness, like the way I told you, a feeling of thirst, wanting to take a lot of water because the body is not getting for it. The body, it will be thinking you are not taking enough water, so it has now to stimulate you to take what? More water.
Okay, thank you very much, Mr. Wycliffe. Hope our dear viewers are getting to note of these symptoms you could be having at home, which could be a sign that you have an intestinal obstruction. Mainly to note in case you fail to pass stool for more than 2 days and more, and also maybe if you present with other symptoms he has told us. So in case you get any of those, please, our dear viewers, take note and visit the hospital for further and specialized management. So maybe, Mr. Wycliffe, to ask, a viewer may be already asking, you have told us how worrying this condition is, having an intestinal obstruction, all those cases, how they present. A viewer may be asking himself right now, which things can they do to put them at a risk of getting this intestinal obstruction? And apart from the risk factors, what are the specific causes of this intestinal obstruction? Thank you.
Yeah, thank you, Mr. Moderator. Now to start with, let me start with the what? With the causes. Then I will go to the what? The risk factors. So causes, there are very many. So causes, we mean those things that can lead you to, that cause or that bring about that what? Intestinal obstruction. So one, we have diseases like diverticulitis. So what are we meaning by diverticulitis? So sometimes you find your colon, because the colon usually, it has some weak spots, and usually when the food passes, because of those weak spots, it starts creating like pouches in the sides. So sometimes if there is any infection, that those diverticula, which we call the diverticula, they start being what? Inflamed. So when they become inflamed, it means now the inflammation can what? Can expand. So if it expands, now that one we call it a diverticulitis. So that one, it means as the food is passing, the pain that is in that area, and of course because of the weak spots that have been, a lot of weak spots that have been what? That have been created in that area, the food cannot pass very well. Yeah, leading to what? Leading to intestinal obstruction. So another one, we have like volvulus. Sometimes you find your intestines may twist on each other. So, you know, for them they are always twisting, but however, they don't twist, like they don't coil on top of each other. So if
like they tie around.
So if they tie along each other, we call it a what? A volvulus. And it means if they tie, that food will not be able to what? To continue passing. It has to start now accumulating in that area. So sometimes we have also what we call intussusception. So intussusception is where part of the intestine, it now inverts itself into it again. So that one is what we call intussusception. It means we have reduced the distance through which it can what, and we have also narrowed the space inside through which that food can pass, leading to accumulation in the other area. So we also have other diseases like which we call Crohn's disease. So Crohn's disease and also ulcerative colitis, these affect the inner lining of the what? Of the colon. For Crohn's disease, it can affect any part of the intestine. However, for the ulcerative colitis, for it mainly specializes in the colon. So those, they cause inflammation of the inner lining. It means if it is inflamed, you may have pain in that area, meaning the food, when it is passing, it may not pass because there is pain. So it means it cannot pass the way it should be passing normally. Yeah. So sometimes we also have what we call hernias. So hernias, a hernia, that is a protrusion of a body part, usually an abdominal part, through an opening. So for example, we have ventral hernia. Yeah, a ventral hernia, we have scrotal hernia, inguinal hernias. So the part of the intestine, you find it passes through a weak spot, and it puts itself into what? Another location where it should not be. So if it puts itself in that location, it means now that area of the intestine is trapped.
Okay. Maybe to ask briefly, Mr. Whiteley, if you have talked of the word hernia, and most people in our public, they always say hernia, hernia. Maybe briefly, what is a hernia for a viewer to understand it better?
So hernia, in brief terms, is just a protrusion. Like when you see yourself, sometimes you may find a protrusion, or there is an invagination. There is something which it has increased in mass beyond what it should be around the abdominal area.
Like a swelling.
Like a swelling. It should be differentiated from a lipoma. Yeah, for a hernia, it is caused by pressure. If there is increased pressure in the abdomen, so and that intestinal part, it now protrudes through the what? That area which is a weak spot. That is when the protrusion happens. But in a lipoma, that swelling, it remains there. Or if there is any tumor, it remains there. But for hernia, it is because of an increased pressure in the abdomen. Like you have carried some heavy weight things, so the all coughing, and you see something, it is protruding, which is abnormal. It is not the way your body has been. So that one we call it what? Hernia.
Okay, thank you very much. There are other specific causes of this intestinal obstruction.
Yeah.
Can it be hereditary?
No, it is not hereditary. However, there are some other causes that may bring about this hernia. For example, tumors, sometimes cancer. You see, I've talked about ulcerative colitis. So that ulcerative colitis, if the inside the lining of the intestine, it keeps on being what? Irritated, it may now develop cancer or tumor. So it may start what? Developing a tumor. So that tumor, when that tumor increases in size, it means it will block the way.
Yeah, where food passes.
Where food passes. Now bringing about that what? That intestinal obstruction. Then sometimes we have what we call adhesions. So those adhesions, they happen especially after surgery or scar formation. So you see, after surgery, you have to heal. So that part, when it is healing, it forms a scar. Naturally, you see, when you get a wound, after healing, it will form a what? A scar. It is the same as it is in the what? In the inside your body. So it will also form a what? A scar. So those scars, as it is healing, you might find those two parts of the intestine may stick on each other as it is healing. So if it sticks on each other, it means that area which has stuck on each other, now food will not be able to pass very well. Causing what? Causing the intestinal obstruction. Thank you so much.
All right. Thank you too very much, Mr. Wycliffe. Indeed, it's exciting and educative for our viewers. You are getting to understand of the things which could put you at risk or which cause this intestinal obstruction. Now we can go to the risk factors, because the viewer also may be wondering, could certain types of food be a risk factor to get an intestinal obstruction? Maybe if you eat these hard corns, would they put him at risk of getting intestinal obstruction?
Yes. Now, apart from some of the diseases that I mentioned, that if you have them, you are at a high risk of getting what? Intestinal obstruction. There is also this thing of eating low fiber diet. So eating low fiber diet, it means you are at risk of getting constipation. You see? So because what is the use of that fiber? Why do we say that you should eat fiber anyway so that you don't get constipation? That fiber is very important because when it reaches in the large intestines, it increases the absorption of the water. Like it retains some of the water. So that water which is now retained, it helps it in being what? Pushed through the colon, then through the rectum, and to the what? Outside the body.
Yeah,
smoothly. But if that fiber is not there, it means all the water is going to be what? Absorbed into the system. So that thing that now remains at last, it will be only a hard what? A hard mass, which will now increase the risk of having that what? Constipation. And you said if you have constipation, you are at a very high risk of getting what? Of getting intestinal obstruction.
Okay. Maybe if you may be asking, you have said these, let me take you almost like ahead, then we shall again cover it. Which foods can be good fiber foods?
Okay, thank you so much for that question. So some of the foods that we usually recommend that are very, very good, which have high fiber, one, we have fruits like mangoes, you know them, mangoes, oranges, passion fruits, those ones, they have a lot of fiber. Then other, we have cereals, whole grain foods like millet, sorghum, you see, those, they have a lot of fiber content. So if you take those ones, you will be, the risk of getting that constipation will reduce.
Okay. Thank you very much, Mr. Wycliffe. Could this intestinal obstruction also be age-related?
Yes. This intestinal obstruction is age-related because as you grow, the intestine also, it has overworked. So it means it will become weak. So it means, although it can happen at any age, but as you grow, it will become weak. And if it becomes weak, it means, that's what? It means now the ability of that food to pass through that system, it reduces. Now increasing that risk of. So age, sometimes the more you become aged, the more you are at risk of getting what? This intestinal obstruction. Although it can happen at any age. Yeah.
Correct. Thank you very much, Mr. Wycliffe. Maybe as we're almost coming to the conclusion of the first segment, in case a viewer outside there gets any of those symptoms we talked of, they fail to pass through, they feel they are dehydrated, they have the dry lips, the sunken eyes, what home remedies can they do before they go to the hospital to seek specialized or specific health care?
So number one, because at home we are not sure whether it is intestinal obstruction or something else, it is we don't have any home remedy as of now, which is at home. And because sometimes you may take some laxatives, sometimes you find you go to a clinic and they give you a laxative.
Maybe be specific, what's a laxative?
So a laxative, these are drugs that reduce the intestinal motility or the intestinal movement. So it means if the intestinal movement is reduced, if we reduce the intestinal movement, then the passage time, like the amount of time the food takes to pass through that intestine, it reduces. So it also reduces that pressure on the food because of the contraction of the of the intestines. So that's the use of a laxative. So we don't encourage that you also take laxatives. Why? Because we don't know what is causing the The intestinal obstruction. Sometimes you find it is a It is a tumor. And if it is a tumor, it means even if you give a laxative, still the blockage is is there.
Okay.
So
maybe let's have it at a hold for this first segment. Then in the next segment, we are going to come with more of the home remedies. What can you do in case you get these intestinal obstructions? Still with our wonderful guest, Mr. Wycliffe, who is taking us through an intestinal obstruction. Then also in case you have a neighbor, tell them to also tune in, because in the next episode, it's going to be more exciting and educative. Thank you very much. Let's get back after this short commercial break.
West Nile TV, lighting up the region.
The search for Miss Uganda 2024 is on. Get ready to be wowed by the girls' intelligence, charisma, and big dreams. Who will will be the next Miss Uganda? Find out starting 10th May every Friday to Sunday at 8 p.m. on Makulachika, exclusively on Star Times. The show is sponsored by LMZ, Comform, Nanjing Hotel, Kira Motors, Sheraton, Uganda Airlines, and lead sponsors, Grace Textiles and U-Home. Miss Uganda 2024, True Ugandan Beauty.
West Nile TV, lighting up the region.
We'll be back, dear viewers, from that short commercial break, and it's still the Daktari Health Edition on West Nile TV every Thursday from 10 a.m. to 11 a.m. and I'm always your host, Sunday Junior Tom. In the first segment, we had our guest, Mr. Whiteleaf, who took us through what intestinal obstruction is. I took her through the causes which could put you to get this intestinal obstruction and the risk factors. And he told us some of the home remedies in case you have someone at home who is not passing stool, someone at home who is dehydrated, the lips are dry, the eyes are sunken, they are feeling weak or lethargic. He gave us a few home remedies you can do at home, and in this segment is going to give us more of these remedies we can do. We'll be back from that short commercial break, Mr. Whiteleaf.
Thank you, Mr. Moderator.
Okay, so we can pick on from there. Which other home remedies can a viewer do at home? Because actually what's running in my mind, since these people, they're not passing still, are they advisable to take water?
No. You see, as I said, we don't know the cause unless you come to the what? To the hospital or a big health facility. Now, when you take water, it means that water is going to also accumulate in the what? In the intestine, or that blocked part. Which means there is no use of what? Of taking that water. Instead, you will be adding on the what? On the accumulation. So we don't advise that you take anything. So you should not take anything until you first come and we see what is really bringing about what? That thing. That's why I said we also don't recommend laxatives because we don't know what is the real problem. Then again, herbs. We also don't recommend herbs. Yeah, we have to first establish what is the cause before we can give you all that. But if you just take herbs, we don't know the unknown side, we don't know the side effects of those herbs that we are going to take. So it is always very recommendable that you come to the health facility for what? For checkup.
All right, thank you very much, Mr. Whiteleaf. Hope our dear viewers have gotten to know. Please, in case you have any of those symptoms, don't take water because it may instead worsen the situation. So, when someone has come to the hospital, how do you guys always diagnose, let me say, to make it easy? How do you guys confirm that this person is having an intestinal obstruction in the hospital?
Thank you for that.
Yeah.
So, first of all, when you come to the hospital, for us we have a protocol which we follow. Now, first of all, we shall first triage you, or we first arrange arrange you according to the severity of your condition. So after that, we shall go for what we call stabilization. If, for example, your heart rate was high, your blood pressure was low, your respiratory rate was high, so we have to take measures that can first, we call it life-saving therapy. So we first give you the life-saving therapy. Then we know that you will have lost a lot of fluids. So we shall also put now the IV fluids because you know there is dehydration. But you see, we didn't say that you pass through the mouth. For us, we shall give them direct into the blood because the problem is with the absorption. So we pass them direct to the what? The blood. Then sometimes you find there is electrolyte imbalance. For example, if you have partial obstruction, so sometimes with partial obstruction, you get an obstruction, then again you have a lot of diarrhea. Then you again get another obstruction and also get what? Diarrhea. So in such a case, you lose a lot of what? Electrolytes, like the potassium, the calcium, phosphates, magnesium. So those ones, we also give you what? We shall give you some electrolytes. Those fluids that we shall give you, it will be containing some electrolytes. Like the Ringer's lactate, it will be containing some electrolytes and also the normal saline. So we can give you the what? Dose to now counter that. So after that stabilizing you, now we shall go to physical exam. Then we shall examine you to find out. We may do a head story assessment or we may do focused assessment depending on how we get you. Then from there, after doing physical exam, we shall need to make some investigations. Like the x-rays, we can take you to the x-ray department and we find out what is inside your abdomen, what is causing this problem. So we can also do ultrasound scan and we find out. We can also do a CT scan. All those we do them to what? To find out what could be the what? The problem. So that when we are going to manage you, we get where we can what? Where we can start from. So now, after those investigations, that is when we start now serious management.
Okay, maybe to ask a question that I'm not supposed to know this. In case maybe I've done a CT scan and maybe a person has an intestinal obstruction, what do you always see on those scans? Do you see, because you said these people fail to pass through, maybe due at some intestine, maybe when it's what? Let me say intertwisted or tied around.
Yes.
Do you see this fecal content there accumulating?
Yes. So if it is a volvulus, like there is that twisting of the intestines, we shall see it, and therefore we know what we shall do. If it is fecal impaction, like a lot of secondary to the constipation, we shall also know it, and we also know what we can do again. Then also, if there are tumors, we shall also see them. Those investigations, they help us. It is like a camera. We pass, like we do a shot inside your body without entering you. Or sometimes we do laparoscopic surgeries. We draw a small incision on your abdomen and we pass a camera inside you, and we see what could be the cause of the problem. So then we know what we can do for you. Yeah, even in the laparoscopic surgeries, we might find we may cut, and we just look for what is the cause just by inserting our hands. Those are now in the surgical part of it.
Okay. All right. Thank you very much, Mr. Wycliffe. And indeed, it's exciting. Hope our viewers are getting to know how these professionals get to know whether you have an intestinal obstruction, how they always diagnose or confirm. So maybe we assume someone came to the hospital and this person has an intestinal obstruction. How do you guys always manage these people after stabilizing them?
Okay. So, for example, if it was like tumors and we have cut them out, it means after you will of course develop a wound, there will be a wound which we have created. So it means in the post-operative care, we shall have to do wound management or wound care. Yeah. So after surgery, there is also continued monitoring.
Maybe to ask, what do you do in the surgery itself?
In the surgery itself, of course, even before the surgery, we first prepare you. Yeah, we make sure we obtain the consent. We make sure we arrange the equipment, those necessary equipment. Then we make sure we do that surgery and we remove the cause. Then in fact, inside the surgery, we may also need to anesthetize you or to give some anesthetic agent which may reduce the pain. Yeah, because you will have a lot of pain. So that's why we put some anesthetic agents so that you will not feel pain as we do the surgery. Yeah. So after correcting that, that is when we shall now again do post-operative management. So in the post-operative management, there are some key areas that we do. One, we do wound care, as I said. We make sure the wound is sterile. We give you antibiotics, which prevent the infection in case. Then we also clean, we make sure the bed is clean. We monitor the vitals. We make sure the vitals, your respiratory rate, the blood pressure, the temperature, we make sure they are what? They are stable. Then we also make sure that you have meal per hours. You don't eat within the first 48 hours. You don't eat anything. And we shall after review you. If we can see that you can start taking something, then we can allow you to start eating some soft foods like the eggs, which are higher in protein in nature, because we want now you to heal faster, to help in the wound healing and faster healing. Then we shall progressively now allow you to eat some foods which are hard. Yeah, so it is like a step by step. At first, we shall not allow you to eat. We shall be doing intravenous food. We shall be giving intravenous foods.
Yeah, then, you give this food through the blood vessels.
Through the blood vessels. Then after that, we shall start giving you soft foods. Yeah, we advise you to buy some eggs. Then after that, we can now progress and we say you can start eating some hard foods. So that is how we do. Then we also do physiotherapy, because like exercise therapy, because that exercise therapy is very important in the in the healing process. So when you have exercise therapy, it means you can easily faster heal, because it helps the blood to come near that where we have cut. Also it brings around the white blood cells, which are very important in the healing of the body. Yeah. So we also do follow-up. So after like surgery, then we have monitored you for 2 to 3 days and you're okay, we can discharge you. So after discharge, we have also to do follow-up. We make sure your wound is free of infection. Like there is no infection which has developed on that part. And how can you do it? How can you know that there might be some infection on that wound? First, you identify that there might be some redness around that wound. Yeah. Then second, you may feel it is hot. That wound is hot. So, or sometimes you may see some discharge, some passing coming out of the wound, meaning there is infection. And if you notice any of those, you have to come back now to the hospital for review. Maybe
to interject in, you told us the management is surgical, meaning you open up the stomach of the patient. In case you have opened the stomach of the patient, like you have done all that hospital management and you have discharged the patient to go home safely, you have told us the signs, how someone can know maybe the wound or that surgical site has gotten an infection. How can these patients in the community who have undergone these surgeries maintain or manage these surgical sites free or safe from getting these infections?
Okay, thank you for that question. So first of all, when you go and we have discharged you, we give you instructions. So those instructions, you are supposed to follow them closely, because those instructions, they include how you are going to clean that wound, how to always maintain that it is clean. Don't use any dirty cloths around that area. Yeah, even when you are cleaning that wound, you have to make sure the water you use is clean water that is boiled, free from from the infection. So you have to take the antibiotics that we give you. Those antibiotics, they help in prevention of the infection. So those antibiotics, they will be very important, because they will now prevent that infection from coming. Yeah. Then you also do the exercise, as I said. That exercise will bring the white blood cells near that wound, which will now help it in the surgery, in the healing. Yeah. So if you follow those instructions, you know within just a few days you will be okay. The wound will heal very fast.
Okay. Maybe to ask a question, you can maybe clarify. On that surgical site, is it advisable while they are doing, let me say that, sponging, is it advisable to use warm water when there is some salt?
No.
Okay.
We don't advise any salt in that wound, in the wound.
Okay.
Yeah. We only advise clean if the water is boiled, but clean. Yeah. Without anything. Yeah.
Okay. Thank you very much, Mr. Wycliffe. Indeed, it's exciting. Hope our viewers are getting to know, you're getting educated in case better this knowledge to tell the viewer is not only mainly on this intestinal obstruction management of the surgical site. Even maybe if someone has undergone any other surgery, it is still the same knowledge they can carry on to manage these surgical sites.
Yes,
so you have taken us through this management. A viewer may be asking, are there other diseases which present like an intestinal obstruction maybe?
Yeah. For example, we have like the way I told you, hernias. A hernia may present in such a way, especially if it passes. If you apply that pressure, like you through coughing or doing heavy exercise or lifting some heavy things. Yeah, those typical conditions can come. Then we also have diseases such as like having like those Crohn's diseases that I talked about, the ulcerative colitis, they may also present in the same way, but they are not what? They are not intestinal obstruction. Yeah, so such can also present in the same way.
Okay. All right.
Then maybe also if you have intense diarrhea, it may also present in the same way. Yeah, you may have lethargy, you may have abdominal pain, intense abdominal pain. In fact, even sometimes you find that the diarrhea, it is also bloody. So such things, they can also present in the same way.
Okay. Thank you very much, Mr. Wycliffe. Hope our dear viewers are getting to note things related to which can present or relate like an intestinal obstruction. Also to ask, you have taken us through this exciting journey regarding intestinal obstruction. Are there complications a viewer outside there may develop in case they are reluctant to go to the hospital to be managed of this intestinal obstruction?
Yes. In fact, those complications sometimes they may happen even after surgery. So, for example, we may do surgery, and after doing surgery, we said after doing surgery, there is always scar formation. Of course, the wound has to heal, and as the wound is healing, usually the body, it has inside it, there is the greater momentum. We call it the greater momentum. So whenever the wound is healing inside the body, that greater momentum tries to shift towards that area because it contains those white blood cells which are important in fighting if there is any infection. So sometimes it sticks on that area. So in the process of healing, so if it sticks on that area, it causes what we call adhesions, which I talked about also. So those adhesions, they may now cause other complications in the future. That's why we said you need to come for what? For follow-up always, so that we know we prevent that. Yeah. So another complication is if you don't manage it, you may develop those Crohn's disease. You may also develop it. You may also develop ulcerative colitis. You may develop the diverticulitis or the diverticulosis. You may also develop it. So those are some of the complications. Then sometimes you might find you may develop peritonitis. So especially now, if you don't come, it means as that food keeps on accumulating in that part of the intestine, it will reach an extent of where the blood vessels which are running along the intestine, they will now be blocked. So if they become blocked, it means that area which has been blocked, it will now start dying off. If it dies off, it means now the food which is which was inside, it will look for a way out. And if it gets its way out, for it, the near place where it can go, that is the what? The peritoneum. And if it reaches the peritoneum, it will cause peritonitis. And in fact, it can also cause infection. So you may get peritonitis and also get infection, which may also come in as a result. Yeah. So such things, they may now become as complications.
Okay. Thank you very much, Mr. Wycliffe. And also our viewers have gotten to note, in case you are reluctant to go to the hospital to be managed with this intestinal obstruction, you can get such of those complications. Now when we go to the prevention, the viewers entirely go to this education regarding intestinal obstruction. How can a viewer outside there prevent getting this intestinal obstruction? It be through nutrition, exercises, and maybe any other things. How can viewers of Western TV prevent getting these intestinal obstructions?
Thank you. In fact, I'm very happy that you are saying some of them. So one of them, we have good nutrition, eating high fiber diets, like the way we discussed, because that one will prevent what? Constipation. And if we prevent constipation, it means the risk
the
of
stool
getting,
will also easily flow.
it will easily flow. Then another thing, we have drinking enough water. If you drink enough water, you will always stay hydrated, and it means even the passage time of that stool, it has to what? It is. But if you don't drink enough water, it means the little which is in the intestine has to be absorbed, and it will now even predispose you to constipation.
What is the recommended amount of water a viewer should take daily?
We usually recommend 5 liters, 5 to 6 liters of water in a day.
Can a viewer outside there take this? These 5 to 6 liters.
It is what we usually recommend. However, for sure, I know it is always sometimes hard to maintain that. But if you really get at least to get to 4 or 4.5 liters, at least try to take at least that one. And please always make sure you take the boiled one. Don't now go anywhere, because there are other diseases which are also in that water which is not boiled, like typhoid. So such things which we don't want. Then exercise. Exercise is very important. Why? One, it improves the immunity. So it means it will fight against infection if it is there, that may lead to that intestinal obstruction if it is there. Then again, that exercise, it helps in the GI motility, the GI movements. And if the GI movements are okay, it means if food comes, it will pass. And the one which is supposed to be absorbed, the one which is supposed to be eliminated, be eliminated. So exercise is what? Is very paramount. When we say exercise, we don't mean that you become like athletes. We even have some simple exercises. Just doing some jogging, small jogging, like in the evenings after work. You can do some small jogging, and you will what? And you are good to go.
Are there any other ways a viewer outside there can prevent this intestinal obstruction apart from the jogging, the nutrition, where you encourage taking more of the fiber, and also you talked of taking enough water? Are there other ways a viewer outside there can prevent?
For example, we have maintaining a healthy weight. You see, when you are obese, it means also your intestines, the inside of the intestine also narrows. And if it narrows, because of the fat deposits, so if it narrows, it means also as food is passing, it has a high chance of what? Of clogging back, cramping back, now causing the intestinal obstruction. Then sometimes we also advise that you take small frequent meals. You see, some people, they like eating a lot of foods at one heavy meal. You eat your enyasa, you cook like 1 kilogram of enyasa, and you Don't eat it at once. It is not advisable, because the way you have eaten it, you are giving a lot of time for the body to what? To digest it into small what? Particles. Which means the body will also get tired, and some of it will now start accumulating.
West Nile TV, lighting up the region.
Cameras, check. Lights, check. Sound, check. Judges, check. Action! Get ready for the Miss Uganda Grand Finale live at 8 p.m. on 3rd August 2024. 28 finalists in boot camp. One crown. Who will be the next Miss Uganda? Follow the beautiful journey to the final on Makula Chika, exclusively on Star Times every Friday and Saturday at 8 p.m.
Sponsored by VNA, LMZ, Comform, Nigerian Hotel, Kira Motors, Sheraton, Uganda Airlines, and lead sponsors, Dress Textiles and U-Home.
Miss Uganda 2024. True Ugandan beauty.
West Nile TV, lighting